All right, it's my pleasure now to introduce this brief session. This is held by two esteemed education editors as part of our societal journal, journals. So the title of the talk is How to Succeed in Publishing, Medical Education Scholarship. We have Dr. James Bates here, and on the web is Dr. Paris and Ingledew.
Esteemed might be a high word. Maybe for Paris, but not for me. Who are we first? I'm James on the far side of the screen. I'm an assistant professor at Emory. I'm an associate section editor at PRO. I work on most of the education papers that come in that I'm not involved with. And I'll let Paris introduce herself. Since you can't see her, here's a picture of her.
I'm Paris at Ingledew. I'm a clinical assistant professor at UBC. I'm the department head here, and I'm also the section editor for medical education at the Red Journal. And don't ask me why they chose me, but I'm learning a lot.
And one of the things that we both wanted to do in doing this is help you guys and all of the awesome projects that we've heard about today really refine both project development and how you create them into manuscripts to submit to our journals, since we both get a sizable volume of educational papers to review, and just make sure that what we're looking for is clear to you so that you guys know what we're looking for, or at least some general idea. I'll let Paris start.
Great. So I don't know if I hope everybody can hear me okay here. So, you know, when James and I first met, we asked each other, what would be really practical for people to know here? And I think it's really not a secret in terms of what we're looking for. Like everybody in this room, we support strong educational principles and foundations. And actually the criteria by which we look at what we want submitted are actually grounded in strong research. And we're going to go around some of these, so we'll say guidelines or guardrails today. So next slide. So just first, you know, today we've heard a broad description of different areas of scholarship in medical education. And you can see that we can challenge ourselves to look beyond just the randomized control trial or the experimental design, studies which include integration, application, and teaching. And as many of us know, Boyer defined these back in the 1990s, these 4 areas. And actually, when things are being submitted as manuscripts, I would challenge everybody to think more broadly than just the realms of discovery. Next slide. But aside from the areas of scholarship, what truly makes something scholarly? Hutchings and Schulman define this and the 3 essential areas for scholarship. The work must be made public. And in fact, by hearing many of these presentations today, you've already started your steps to scholarship. It must be available for peer review and critique according to accepted standards. And as we know, there's many venues for peer review, but one of them includes the journals in which James and I are involved with. And the work must be able to be reproduced and built on by others. What foundation does this contribute so that we can all grow together as a specialty? Next slide. So in terms of the things that we're actually looking for, James and I quickly realized that we use a very similar framework. The Carnegie Foundation, you may remember, went out in the 1990s to actually look at what were the criteria that made them something quality scholarship. And they went to journals, granting agencies, and peer reviewers. And when they collated everything, there were 6 clear themes in what could help to make something higher quality scholarship. And these included clear goals, adequate preparation, appropriate methods, significant results, effective presentation, and reflective critique. In fact, many people have looked then since in terms of the medical education literature. And despite clearly articulating these goals, it's probably not a surprise to you that many authors still fail to articulate their goals clearly, adequately prepare, or even choose the right methods. And as such, we thought we would focus on these a little bit just to give you a little bit more context. Next slide. So in terms of clear goals, the first thing that happens when I get a paper is I look at it and I think to myself, really, what was the purpose of this work? You would be amazed at the number of times that people are not actually able to clearly articulate the purpose of their study or manuscript in the very start part. What was your elevator pitch that you would have told somebody about? Also, too, I encourage people to be authentic to the purpose. When I open up a survey associated with a study, for instance, and there are actually 3 components to the survey, of which only one is reported in the manuscript, it makes me wonder what happened to the other 2. Or were these accessory purposes? Try to make things realistic and achievable. And as George Bardage would say, small is beautiful. If you refine your question to a question that you clearly articulate at the beginning and follow that clear articulation right through the end, it makes it much more clear for the reader and the reviewer to follow it. And to take the time to identify important questions in the field. And remember this concept that not everything needs to be a randomized control trial. And you can take integration, application, and teaching to new levels. Next slide. In terms of adequate preparation, what are we looking for? We asked ourselves questions, did you bring together the necessary skills and resources necessary to move the project forward? If this is a study that's strongly bounded in qualitative literature, qualitative research, did you actually have qualitative research skills yourself, or did you use them from others? If this is a study looking at validity or validity concepts, did you engage an expert in that area? And what understanding do you have of scholarship in the field? Did you do an environmental scan, a needs assessment, or a literature scan? Many of us should be prompted to look outside of our field, for instance, to other healthcare disciplines, nursing, dentistry, social work, etc. And also into reviews such as BME reviews. And if you haven't looked at BME reviews before, these are essentially the Cochrane reviews of medical education and may help to provide grounding for your literature. In addition, I would like a minute to focus on a conceptual framework. Turn to the next slide, please. So those who've done research with me and many others in medical education get a little bit bored of these, but conceptual frameworks can really be a grounding for research and can really help you to form your manuscript or your research project to another level. There are ways of thinking about a problem or studies or ways of representing how complex things work in the ways that we do. And in the plenary lecture beforehand, there was full of conceptual frameworks. These frameworks can help us to emphasize different variables and outcomes, and they can help us to see our results in a new light. I put some examples of conceptual frameworks here on the side. And for instance, you may have seen Kirkpatrick's evaluation framework used before. And this would be an example of a way that you could frame a manuscript to show purposeful evaluation, designing not only your study design, but also reporting at the end in your results. Next slide. And finally, did you choose appropriate methods for it? As I said, not everything needs to be a randomized control trial. We can remember that there are alternative methods for the goals, including observational studies, systematic reviews, ways to properly conduct validity studies, and on and on. In addition, I'd make a special call out about the differences between qualitative or quantitative research. And in fact, maybe not so much the differences, but the similarities. Next slide. So commonly, we will have people submit, for instance, qualitative research and analyze it in a quantitative framework. But it's actually okay to call qualitative research, and quantitative research, and actually they can coexist, as you know, in a study too. But the grounding principles of qualitative methods, although the data may look different in the forms of number or forms of words or phrases, is still the same. You need to formulate your questions, be very purposeful in selecting your sample, collecting data with very sound methods, analyzing and interpreting and drawing conclusions. You need a careful plan to guide collection, analysis, and interpretation of the data. It's not enough just to say that you did a qualitative study, but actually engage people who are qualitative experts, take the time to learn about it, and then do a study that would match with the same rigor as a quantitative study. So James?
So the next step is thinking about our results. It's important to have significant results. And the first step of that is answering the question, did you achieve your goals? And that gets back to what Paris talked about. If you can't define your goals, you can't achieve your goals. So it's very important to take that step very critically first. Second, as with any research, is this a consequential addition to the field? I think I'd urge everyone in this room to move more and more towards competency-based assessments to really get a better understanding of our projects moving the needle. I can speak for myself and my editor-in-chief that studies that just show learners liked or learned on an immediate post-intervention assessment are likely don't meet that threshold for us in most cases. Obviously, there's no yes or no hard line in reviewing. It's also important to consider areas for further exploration. Use the whole data that you collected. Just as Paris mentioned, be true to your study. Don't leave out 2/3 of the survey that you did because there should be valuable results in that, or why did you make the learners or whoever take these 50 question surveys, or however you're assessing them, use the data that you collect. The second is effective presentation and considering the appropriate form. There's a lot of different places to publish medical education scholarship. There are medical education journals like Academic Medicine or Medical Education. And if impact factor matters to you, both of these journals have an equivalent or higher impact factor than the Red Journal. So these are major medical journals. There's outputs like the MedEd portal or Merlot, which are very appropriate for resources that you just want to put out there. We've done this thing, we've made this thing, here it is for other people to use. There's various barriers to this, a lot of logistics, especially with MedEd portal, but they can be very helpful for very straightforward projects. And then, of course, I can speak for my editor-in-chief, and I'm sure for Dr. Yang and Paris as well. We all want to support education scholarship in the Astro journals, in PRO and the Red Journal. Speaking specifically to PRO, the first word in PRO is practical. And we're most interested in manuscripts which can be directly implemented in some way. It's a practical radiation oncology journal. And so it's important to have suitable style and effective organization and clarity in the methods that you present. The methodology you describe has to be able to be replicated, or alternatively, providing us with the ability for readers of the article to take the course or have some video of how you created the course or showing off, this educational style. I'm sure that many of you are better writers than I am, but a video is often an even better writer than any of us at really clearly showing a concept such as education that can be very hard to write down. 6, reflective critique. It is important to critically evaluate the results that you present. Curriculum development is not static, otherwise none of us would be here today. It's an iterative process, and thinking about how the data that you present is able to be fed into your next iteration of developing whatever framework, whatever resource you're working on building is very important. Further, placing it in the context of other future work. What are other people doing? How is your intervention different, unique, additive to what we know? And this gets back to what Paris talked about doing a thorough literature review, looking at things outside of the field of radiation oncology. Many of the problems that we face in education are not unique to our field alone. Some opportunities in this space, I'd like to call attention both to the Red Journal Resident Peer Reviewer Training Program, REPERT, and the PRO Reviewer Apprenticeship Program, which are similar but slightly different programs, where essentially you work with one of our editors to work on your reviewing skills. I have 2 with me right now. They're both very good. I think that Paris has a couple that she's working with right now.
Exactly.
The ROECSG committees are great entry point opportunities, especially for residents, junior faculty like myself. It's a great forum to kind of build these ideas with people who are also invested in this. The CARA, the Canadian Radiological Society, has an education committee. Astro has an education committee. Aero has all these things. There's various committees to get involved with, and just getting out there, being involved. It's a great thing. I welcome, and Paris does as well, any questions. And you can reach out to either of us if you have, questions specifically that you want clarified. I'm glad to answer your questions or try to help improve things along or take any inquiries. Thanks.